Catching health concerns before they happen. That's the importance of getting your annual physical exam. And approximately 60 million children and adolescents participate in sports every year. Staying active is beneficial for your health, and making sure your body can handle the activity is just as important. Joining Mid-Michigan Matters today is Dr. Leila Smith, a Health Sparrow family medicine physician. And Dr. Smith, how do physicals help prevent and catch any health risks?
Physicals are important to make sure that the child and adolescent are healthy, growing appropriately, and that we're screening for any potential health risks, such as any family history of heart problems, arrhythmias, genetic disorders.
And what exactly are you looking for during a physical exam? You talked about the family history and talking about heart health. So how do you check for that?
Yeah, so we actually use two parts. By following the pre-participation physical exam sheet, it has both the interview questions that go through their health history, any prior illnesses, injuries, family history, but we also do a physical exam where we're listening to their heart, lungs. We're looking from a head to toe perspective on their function and how their muscles work, how their balance is, how their heart and their lungs work.
Getting a full evaluation of how the body is doing, just that quick little checkup. But do you notice any common concerns when it comes to children, adolescents, adults?
Luckily, no. Most of the time, children and adults are just fine to participate in sports, and it's so important to stay active and stay healthy. So there's no real common things, but we are looking at things like if you have asthma, are you breathing well? How are your lungs doing? And do we need to make any medication changes?
All right, and what might some of those changes look like? Do families need to come with any questions, any forms?
Of course, come with your questions if you have any concerns. So the good thing is that this is covered with your normal well child exam. So if you're scheduling that after April 15th, then it's just part of that wellness exam. There is a form that they can find online, or the schools often give it to them for the sports physical.
And what is the risk of not getting an annual exam?
I mean, the risk that we're really trying to catch is preventing any serious injuries that may occur, or even death from sudden cardiac death or arrhythmias.
And cardiac arrests, we've seen more of that pop up in the news recently. What can you speak on that?
So we're just trying to make sure that there's no family history that we can pinpoint. We're doing things like listening to their heart in different positions, maybe even during a squat and things, to see if we can hear any of those subtle changes.
So going from being stagnant or standing still and then doing activity to see how that changes.
Absolutely.
And now scheduling a physical exam. There is a link that people can go to sign up or make an appointment. What else do they need to know?
Yeah, so you can contact your primary care physician, like I said, for a well child check, as long as that is after April 15th. But if you can't get in, if you're having some difficulty, we offer the walk-in clinics and the urgent care, and you can go right online at uofmhealthsparrow.org/sportsphysicals, and that's just a $25 fee to have those completed.
Perfect. Dr. Smith, thank you so much for joining me in Michigan Matters. That link is at the bottom of your screen, and we thank you for joining.
Thank you.